Hey everyone, welcome back to the Hilton True Wealth podcast. I'm Mark Miller, manager of the Hilton Family Office, and today I'm joined by Dr. Raj Kumar, chairman of the United Doctors of America, and we'll be discussing transparency in the healthcare industry. So, Dr. Raj, welcome again. I know you've already been on one podcast with me, and I'm glad to have you again.
Thank you, Mark. Good to be here.
Well, good.
Very much appreciated.
So tell me a little bit about when we talk about transparency in healthcare, what does that mean to you?
Okay, so, gosh, that's so multifaceted. I think what it comes down to, transparency is a good word, but it's about faith and trust in the healthcare system. If I may, I want to take you down the path of history.
Go ahead, sure.
In the old days, like the Greek and Roman times, who was the doctor? Who was the physician? They sat on teams and boards that helped decide what does housing look like, what does the sewage system look like, how to rear children, and look over the health of the citizen. Fast forward, in a different age of human civilization and development, the doctor was the character who came to your doorstep.
Right.
The house call doctor. Came into your living room, treated you, your family, your children, your pets, what have you, all in one-stop shop. And then at the same time, they were your part-time mayor, part-time handyman, and the like. Now, today in modern world, what does the doctor look like? Typing away on a keyboard, trying to talk to you about your medical issues.
Yeah.
And so because of where
And
we
going
are
from
today,
going from patient to patient every 15 minutes.
yes,
Yeah,
absolutely.
just
We've had
boom,
such
yeah.
a inundated healthcare system. We are not well equipped. We become very corporatized, right? Very company driven, almost more than being patient centric. And so there's become a huge disconnect from the doctor, the nurse, and the patient, the person. I myself, I'm also a patient, aren't I? So when we talk about transparency, we're really talking about trust, faith, the old ways where you had that love, that bond, that friendship with the doctor.
Sure.
Some of it is still here and there in sort of smaller communities, in my humble opinion.
Yeah.
But in our bigger cities, in those urban jungles, in those heavy, busy hospital systems, it's just not there anymore.
Right.
There's just not enough time with the patient, just as you delineated, the doctor spending time with the patient. I mean, 10, 15 minutes at best if you're lucky, and then move on like an assembly line to the next, to the next, to the next.
Right. Yeah.
So what we do at United Doctors of America, I've mentioned before, we have this trifecta mission where we advocate for patients and providers, and our issues touch on reform, transparency, and wellness. So transparency is a big issue for us, especially with what happened with COVID, when there was a little bit of a breakdown, globally speaking, between the general citizen and government and the general citizen and healthcare, because it was a huge healthcare cluster, you know what.
Yeah.
So that's why that's a big piece of our advocacy.
Absolutely. So when we talk about transparency, I'm assuming maybe you're talking transparency so it's a higher level also at the government level, or even like pharmaceutical companies, big healthcare companies. So what does that look like? And what are you guys doing in United Doctors of America to kind of combat some of those issues that are happening there?
Good question. So sometimes that's a little bit of a hard nut to crack, right? Because now to say, hey, big pharma, hey, big hospital system, hey, big insurance company, we'd like you to be more transparent. And what does that mean? We want to know what the patient's being billed for. We want to know what services you're covering and not covering. Where did you make a vaccine? How did you produce a medication? What clinical trial did you do? What does the legislation look like? Some of it, think of it like the tax code, if I can for a minute. It is open source, so to speak. It's open and visible to the public, but doesn't mean you understand it.
Yeah.
You give me a manual on a Ferrari engine, I'll be like, I love a Ferrari engine. But if you give me the manual of how to either assemble it or treat it, I'll be like, you got the wrong guy. It's like you're asking me to do ballet. Somebody's going to get hurt. It's not good.
Right.
So my point is, these parts of the healthcare system, as much as they might need to be disclosed, would be confusing to the general public anyway.
Sure.
But these big bodies, because they have such a huge lobby and a play in our overall global system, not just in the United States, they don't always have to be so open and transparent. I mean, we've seen issues with the FDA, the CDC, NIH. I mean, you can even go down to, law enforcement systems. So because of that factor, we may not be able to touch those sources to make them fully transparent. So we do something a little more at a local to national level, sort of within our purview, within our orbit. And I can talk a little bit about that, how we're trying to push out a little more transparency, openness, retrust with the healthcare system.
So it still starts at a local level, like you've talked about before, and then that kind of has to work its way up into the system, really, right?
That's kind of our strategy. I think I've told you before. So a small example of what we do to make trust. So imagine a general population, right? General population, they say, is 8th grader readership, for example. So even if a doctor sat there and explained everything very technically, they may or may not understand it, but they may not be able to even implement it, right? I mean, even if my accountant tells me XYZ about the tax code, I'll be like, I don't understand, no English, just do the magic for me, right?
Got it.
And that's why you hire an expert, right? Whether it's for your car, for your taxes, for your healthcare, it's the same kind of paradigm. So what we do, as one example, we will have gatherings, like town hall meetings, both on site, on the ground, and online. So just imagine a big auditorium, maybe we got 100 people, 150 people. The general public, like, all are welcome, no charge, come on in, wear your flip-flops and t-shirts, and just sit in the audience. And then at the stage of the audience, you have a panel. You'll have a congressman, you'll have a state representative, you'll have a physician, you'll have a nurse, you'll have a hospital administrator. And now what happens is, with a moderator involved, the general public is listening to them. What are they talking about?
Sure.
Medications, access to healthcare, technology, opioid crisis, mental health, whatever the subject matter might be. And then people ask those panelists questions, good and bad, like, oh, why is my insurance not covering this? Or, hey, Mr. Congressman or doctor, you're stealing healthcare from me. Like, they can get to those rock stars of healthcare, as I call it, whereas normally you can't, right? So we make that kind of interface much more accessible than what they would on a day-to-day basis. And then even afterwards, people go and take photos with these folks, people go and ask them questions, people exchange business cards. So we've had success with that. And then we've done a similar kind of situation online, like on video, Zoom.
Sure.
And you get to talk and chat with these kind of folks. So it's a source of information, it's a source for dialogue, and we believe it's a source for transparency and or trust building.
And that whole town hall concept, obviously, is a governmental concept to where the people can touch their representatives. And it's the same thing. So then the people and those representatives can hear, or the doctors or the members of the different companies, healthcare companies, can truly hear the people rather than just in their day-to-day jobs, kind of just trying to make decisions on their own.
Correct.
And that may sway those decisions that they make. That's kind of what it sounds like, right?
It's a beautiful point you just raised, because I didn't even touch on that. Thank you. How salient is that? It's actually an education, an eye-opening experience, even for those folks who are speaking, who are on such a panel, like, this is the complaint of the general citizen, or this is where I'm where I'm short in my leadership, etc. You're right. Yeah. So it actually has a two-way feedback system in that way. Yeah, that's correct.
Yeah,
and they hear heart-wrenching stories. Some of these CEOs we've had, some of the doctors or congressmen, a mother or father might get up and tell a horrible, rough story that one of their children have gone through, or their family members, and it brings the tears out of you. At the end of the day, healthcare is supposed to be humanity first.
Yes.
That's why we signed up for it, right?
Yeah.
Forget about the business of the game. So that's one way where we've set the stage for a little bit of transparency. And sometimes it's good and sometimes it's bad. I mean, there's going to be arguments, there's going to be dialogue, there's going to be disagreements, but that communication is a very democratic process, especially in the United States. And I think that's the way to get things done. So think of healthcare like a restaurant experience. So the server comes to the table side to meet the patron, right? The restaurant guest. You don't like your dish for whatever reason. So you wring the neck of the poor server. But at the end of the day, what is the server in all of this? The server is just the delivery system. The server does not own the restaurant. The server is not the chef preparing your meal. But because the server is accessible, right? They're the face of the operation. You give your accolades and your complaints right on the face of the server. So by us doing these town halls, I think we have a little bit of a paradigm shift, because now you can find the big boss, the big kahuna.
Right.
You can say, hey, Mr. CEO.
The owner of the restaurant that actually can make something happen.
Exactly.
Truly make something
You can
happen.
go to the CEO and tell them, you SOB, and I don't mean shortness of breath. I'm so unhappy because you cheated me of this money, or somebody in my family got poor care, or something or another, or hey, Mr. or Miss Congressman, you did this, or doctor, you've been unavailable. I have to call 3 different phone numbers just to get you on the line, right? So they can yell at all of us, and that's the way it should be.
Sure.
You should be held accountable to these leadership roles. And the flip side of it, if I can use this restaurant example too, it helps us as nurses, doctors, agents of healthcare. So in the same example I'll use, the server is like the nurse or the physician. We are a delivery system in the healthcare process. We don't own the hospitals or insurance systems, i.e. the restaurants, and we don't design how the healthcare systems operate, i.e. medications, surgeries, other approvals for procedures, as a chef would make the dish. So we're the delivery system that comes to the side of the table and provides the care to the patient or the patron of the restaurant. You get my analogy. And so what happens now, the patron or the patient at the table there, they can get us. They can find the doctor or the nurse much more easily than the congressman or the CEO.
Right,
so the heat falls on us. How many times I've seen that with myself and colleagues, the patient will be upset. Why did I get this medication and not the other one? Well, because your insurance said that. Why did I have a hospital admission staying in the hospital for 2 days when I should have been there for 4 days? And we tell them nicely, you actually signed up for that insurance system. You're the one paying that premium. It wasn't us who chose that. So when the insurance system or the hospital system doesn't do you right, actually we have nothing to do with that. Our hands are not even in that pot. And even if we wanted to be the decision makers in there, we're not.
Yeah.
You think Blue Cross Blue Shield cares about what I have to say, or Aetna or Medicare?
Sure.
Come on, no. So as delivery systems, that becomes very complicated for the patient's experience too, because they can get us. They can catch the nurse or the doctor.
And
they can't get to that chef or that restaurant owner.
Right.
You understand the story. Yes.
Sure, and from a patient's perspective, you're the authority. Everybody respects doctors, and they look to doctors, and they're like, oh, well, you have the ultimate say. When in reality, especially like in a hospital system.
Right.
And we've seen that just in my family when folks have gone into the hospital and everything, and all the different people that are involved and all the decisions that need to be made, and so many people aren't talking to other people in the hospital system, or the one doctor's not talking to another doctor.
Correct.
And it's like it's just discombobulated.
It is. No, that and that's part of our hopes, that when you have a little more trust and a little more transparency, then it helps make the workflow system a little more smooth.
Right.
Because that's why medicine, they call it so defensive in America, because you're always worried about lawsuits, you're always planning some contingency, and in a way you can't give good care. And then, like you said, this discombobulation is because the left hand and the right hand are not talking to each other. The doctors are not talking to each other, the nursing home and the hospital are not talking together, the oxygen supply company and the diabetic supply company aren't talking to each other. And we are holistic organisms.
Yeah.
You need to treat the whole system, kind of like a car engine. You love your automobiles, I know. So my point is, we miss that in healthcare, and I think that's what's hurt us. We're not a preventative care type system. We are more of a treatment-based system.
That's so interesting, because the things you're talking about, and this is the True Wealth podcast, and we talk about wealth a lot, and everything that goes around that. And our whole model is holistic planning.
See?
Because even in the financial industry, the biggest problem, especially on the retail side, is that clients have 4 advisors. None of them are communicating with each other.
Yeah.
They're all fighting against each other in different ways.
Right.
So who pays the price? It's the client.
Yes, correct.
That ultimately pays the price. So our model, the same type of thing, is it's so important. If there's a team of people that are working with you, they need to work as a team. They need to all work synergistically. Otherwise, it's going to be, you maybe can get some results, but it's going to be inferior results, right?
Correct. I agree with you. Yeah. It becomes a mess. I mean, when you raise a child, my daughter is very stellar in her academics. She also plays tennis. She competes. She also sings publicly and competes. I have to manage all of these talents or interests of hers to have this holistic human, this holistic creature, isn't it? Right? You have to be the father. You have to be the authoritarian. You have to be the friend sometimes, right? You have to be the teacher. So you have to wear all these sort of hats to make a complete child. So I agree with you with the patient care. And this is what we're lacking. And this is why not to take the subject matter elsewhere, why chronic disease is absurd in the United States. I mean, our habits are bad, but aside from that, how we've managed our care is very messy. We've been doing Band-Aid care, I like to say. Just stick on that Band-Aid and take care of the problem next time.
Yeah.
And so what we believe is with a little more transparency and trust, maybe we can have a healthier system. Because here's at the end of the day, when a patient comes to a doctor or a nurse, the more they're comfortable, the more they're trusting, the better we look and the better we can do a job, right? Because someone has to disclose what are the issues. And if they're not comfortable, if they're not trustworthy of feeling we've not earned that trust, why would they share, right? So then you compromise health, right? The doctor can't do their job, the patient can't do their job, nobody wins. And then this repetitive sort of broken system just continues one after the other. And that also has to do with time, like you described. In the days of old, a doctor or nurse could sit with a patient for an hour.
Yeah.
Now it doesn't happen.
Or maybe 2 hours.
Yeah. I mean, there's some VIP.
We'd have a meal
and
with
concierge.
them, or
different
share
game.
coffee, or whatever it was. It just doesn't work that way
Society's been
anymore.
like that now. Everybody's a rush.
Yeah.
So that's become a whole nother issue. But even with our transparency motto as one of our mission plans, we do a lot of engagements with the community too, like charity. That helps us to interface with a lot of people, because whenever we do our charitable events, we'll have a congressman there, we'll have some celebrity there, we'll have doctors and nurses. So everybody's in a relaxed setting, so dialogue can happen. I mean, we did 4 turkey drives last year for Thanksgiving. We did a program for Christmas. Yes, I dressed up as the brown Santa. I'll have to share photos with you. We gave out gifts to the kids. So, we're helping a lot of underserved communities, but we also make it fun and approachable. When was the last time you hung out with a congressman or some TV show celebrity or your physician or nurse giving out food and gifts to children and families who are in need? And that becomes such a huge tearjerker and eye-opener for us, too. We do other events. We have a big event coming up with Ferrari, and we're including part of the general public because
I might come to that one for sure.
Get in line. Get in line. Yes. But,
Well, we just came back from one at Trump International.
Yes, that's right.
Yes,
Yeah, we had a big
great.
gala. Yeah, I can touch on that. But see, by making these sort of interface communities, we're showing the world in a way that don't look at some of our communities as elitist, look at some of our communities as being a little more open.
Yes.
Because when we do these fun events where, yes, it might sound a little extra, doing something with Ferrari, but when you have it with some of the general public, now it's an experience maybe they wouldn't normally have. Right?
Sure, and ultimately that trickles down to
too.
the patient that's going to their doctor and being able to have a better experience. Bottom line.
Correct. So at least we've been doing some of these things locally. I've brought in other political friends from, a mayor of a town, a sheriff, this, that, and the other. Now they're interfacing with the general public. So that helps us get a little more access too, because now people are getting more and more comfortable with us. So we're learning what are their needs. What is the patient going through on a day-to-day basis, or their loved ones, or their friends and neighbors, etc. Because, surveys and polls aren't always enough.
Yeah.
So this sort of openness that we're doing seems to be working. This is our first step to maybe going the next step.
Yeah.
And
And so what does that look like? Like right now you're doing the town halls. Are you hoping that kind of just spreads across the entire country through United Doctors of America, or bringing in other organizations to do those things? Or what does that look like?
Thank you for mentioning that. Yes. Yes to both of your thoughts. So we would branch this into other settings, right? In other towns and other states, definitely. And we would co-collaborate with other organizations. We've already started doing such a thing. I mean, the past president of the American Medical Association is actually on our board of trustees of the organization, right? So that has helped become a bridge with the AMA, which is one of the richest and oldest lobbies in the United States. Not everybody knows that.
Of course, yeah.
So when you do these kind of things, both parties benefit, right? I mean, they're a huge entity to say the least, but this also gives them a level of exposure. And those collaborations create a little more of a bandwagon. Now the world will start seeing, okay, doctors and healthcare systems and the hospitals and the home health and the nursing homes, they're being a little more open with us. They're being a little more welcoming because, as you know, we've touched on it briefly previously, COVID. COVID was a big game changer with this sort of transparency and trust for the world at large. And I think that's what we've caught on, to kind of change things. During COVID, it was a very hellacious time around the world. Not to get into too much politics, my own small personal story, I served in 2 different COVID units. 2 of my colleagues, they died. I had 5 people in my own family die. We were wearing astronaut suits in the hospital, so to speak, right?
Sure.
And it was very rough. And, when a patient is FaceTiming on their phone, they're saying bye. Because if you remember in that time, you couldn't bring others into the hospital for fear of, a contagious infection and the like. And so they got ostracized, they got isolated. I mean, we had beds in like the bathrooms and the hallways and the lobbies. It was just the wild, wild west. Around the world. It was just insanity. So there was some misinformation, I believe, at that time. There was a lot of debates about masks, and then even in 2021 about vaccines. So all of this, and I'm not trying to put a finger on anybody, but all of this information that went left, right, sideways, upside down, this, that, the other, created confusion.
Yes. Yeah, that was
and
a lot of
because of
confusion.
that, right. So whether somebody's wrong or right, I won't necessarily say, unless we want to get a little racy, and I'm in for that. Apologies in advance. Yeah. You might have to walk me to the parking lot after this. Okay. But basically, what I'm saying is that think of the general public, right? Everybody is not a politician or a doctor or a CEO. I mean, there's things that I don't know about, right, that I'm ignorant to. So how can I be expected to be understanding of such a topic? So that being said, all this misinformation created such a confusion. Nobody knew what was right or wrong. So what does that do immediately? You just stop trusting sources.
Mm-hmm.
It's kind of like the internet or your socials today, from TikTok to Insta to Facebook, Twitter. You don't know what's real. Mm-hmm. That's one of the arguments of AI. We won't know what is truth and what is untruth in the future.
Sure.
So I think this is what we saw from COVID, from some of our own personal experiences and what we've seen around the globe. And that's why we say we needed to kind of change some of the image of healthcare and government. And what I will articulate with healthcare on 2 sides. One, this was a medical problem. You want to bake a cake for your wife's birthday. You don't go to the mechanic and ask for them to make the cake. You go to the baker, right? You go to the person with the expertise. With COVID, this was a healthcare, a medical, a science matter. No confusion. But somehow, big business and big politicians were on the microphones.
Sure.
Deciding
and making
what to
the
do.
decisions.
Yeah. Outside their expertise.
Sure.
And then, so that was a problem. So that kind of diminished the medical community. But then on the flip side, and I don't want to be that arrogant MD, I have my moments, but the physicians and nurses and the healthcare providers were not able to step forward and get that microphone, right?
Yes.
To then control the stage and say, no, humanity, this is what we need to do because we've seen such situations based on our past experiences, right? Now, many people did try and speak up, and some had some success, some did not, because people, they were gagged, or they lost their licenses, they lost their employment, they were castigated or ostracized in their communities. So I know it's easier said than done, but there's a little bit of fault on both sides is what I'm trying to argue.
Sure.
So that's what I'm talking about. If you really want to get to the core of why this is one of our missions, that transparency and trust really hit the hay, I can say, in 2020. Right? That was a problem.
Yeah.
And it hasn't completely been, rectified.
Yeah, resolved. And I said the biggest thing that I saw, just applying some common sense early on, was I remember coming from the politicians and the people in charge was talk to your doctor and trust your doctor. But like you said, when it really came down to it, is no, don't trust your doctor, trust us. And if your doctor tells you to do something different, don't listen to your doctor. So right there was the beginning of the confusion.
Right.
It was like, trust your doctor, they always say that. And for decades, that's always been, trust your doctor. Your doctor's a friend. Go see your doctor, talk to your doctor, right? And take that advice. But then when this came up, was like, no, our advice is better. Just listen to what we say. And that was a big thing. That was the thing that I saw immediately. And I said, well, wait a second, that's totally incongruent. And that ultimately just snowballed and got worse and worse and worse. And I think ultimately that's why, there's probably a lot less people that would have died if they truly could have gone to their doctor and just let their doctor do what they needed to do to try to help them.
So, anyway. I hear your sentiments on that. And the other side of it too is some people were scared to speak. The doctors and nurses, even if they felt there was a different remedy. because this was something still new, and that made for its own challenge. So you're right. You're right in that way. And we haven't fully come back from it. And then if I may insert a little bit of technology with all of our socials out there, right? We've had such a huge access to information with the smartphone, more than ever before. And so that created a lot of confusion. I mean, to this day, people will listen to a 10 to 20 second clip on Instagram or TikTok as professional advice versus someone they can actually touch and feel and sit with.
That
for
really
half an
takes
hour.
it a long way from 2 hours.
Yeah.
And getting to know you and getting to know your family down to a 15-second clip.
Right.
Then, well, that makes sense. And that's the authority.
Yeah.
Yeah.
And the problem is
Yeah.
you can't always have a blanket statement. Somebody might,
Yeah.
a small example, what one person can take as an antibiotic, maybe another person cannot take because they could have an allergic reaction or there's some other history we don't know about them. So you can't just take this blanket knowledge or blanket information and always apply it to everybody.
Back to holistic.
Yeah.
Yeah. Well, I've always said too, and we'll get into this in our next segment together talking about wellness. And I'm kind of a biohacker, so I'm excited about that.
Know.
But so the body is its own universe.
Yes. Well said.
And you've got billions of people on Earth that each have their own universe. Yeah. And every single one of those people has a slightly different physiology. So you think about how complex that is.
Yeah.
That's why I've always said too, and again, I'm an amateur doctor, but very amateur. But I would say it's no wonder that a pharmaceutical company will make some pill to have a specific target in one portion of the body to do this one thing in the body. It's no wonder there's 30 side effects.
Got it.
Because they got to make it so powerful that it can go to that one spot in that whole universe and take care of that specific small spot. So anyway, I mean, that's kind of a side thing, but I've always thought it's just interesting. It's like the joke is, this medication may cause severe death.
Yeah. The side effects. I know.
The side effects.
All of them say that, right?
At the very end, may cause death. It's like, I've always wondered, maybe I should ask you, you're a doctor. I've always wondered about the one that's like, do not take this if you're allergic to it.
Yeah.
Well, how do you know if you're allergic to it unless you take it? So, anyway.
So first of all, I love what you're saying because we are badass machines at the end of the day as an organism. You're absolutely not wrong about that. But some of these disclaimers or side effects, right? We're making jokes about it. They're covering their butt. CYA.
Yeah. Sure.
Cover your derriere, right?
Sure.
Yeah. That's what they got to do. I remember telling a patient once.
It's like any industry. They've got to. They've got to have the disclaimers.
Correct.
Yes.
Yeah.
By the way, we're giving no doctor advice here.
Okay. It's I remember telling somebody, I think this is in medical school or something, they're asking, why is the medication so expensive, doc? And then, I kind of made a joke out of it. I said, well, a third of it goes to the marketing, another third goes to the attorney, and then maybe another third is actual cost of the medication.
Right.
So it's not just the cost of the medication. There's so many other bills that are around it, especially in the United States of America, right? Because we're such a litigious nation. So it's part of the operating budget. So they kind of laughed with me.
Yeah, we deal with that with a lot of our physicians that we have. I mean, one of their number one concerns is liability issues.
Yeah. Healthcare is like this.
And how are they going to protect themselves when this happens, when that happens? Because if you're a doctor and you're a doctor long enough, there's going to be liability issues.
Right.
Bottom
Correct.
line.
Yeah, even if you do no wrong.
Yeah,
it's
absolutely.
It's the nature of the field because you're dealing with health and life.
Right.
So you become an innate target. Then there's also opportunists.
Yeah.
Then there's also, just realistically speaking, there's a chance for errors, medical errors, right?
Yeah.
It's a practice. It's not a perfection. The healthcare industry is not meant to be
that's a good
godlike.
comment. Yeah. Absolutely.
So
Well, great.
always an improvement.
Yeah, so kind of back to transparency. I mean,
yes,
we kind of
yes.
veered off a little bit there,
Sure.
but it all goes towards transparency and people understanding their health care
Right.
in a better way and being able to, and it sounds like you guys are just really doing great things to kind of go into the system to ultimately help that transparency trickle down to the patient.
Right. And it, not if, but when we do this right, by having the right influencers behind us, whether it's, congressional leaders, medical community, the general citizen, the socials, social media, etc. We believe that maybe we can be a source for information or referral access to other information, which will help build a little more transparency and trust as well.
That's great. By
creating the right team who are there for the right reason, I think that will also help, because there's too many sources of information. So, I'm looking at my daughter, she's a kid, she's a teenager. Can you blame her? When there's 50 sources for the same information, which one do you accept? They don't know.
Does she ever argue with you about medical things?
Of course. Yes.
Well, I saw on TikTok, Dad.
Yeah. Dad, even with your 5 degrees, you're not as smart as me. I get things like this all the time. But my teacher said, or the mailman said, or, I saw this on this social. Yeah, of course. I did it too when I was a kid. That's the way it works.
Absolutely. Well, great. So if people want to get in contact with you, learn more about United Doctors of America or about you or whatever, what's the best way for them
wonderful.
to get in touch
Thank you
with
for asking, Mark. Sure. So come find us at our website, United Doctors of America. That's usauda.com. usauda.com. We can be a great source of information. We have helped people get their medical appointments. We've helped people have questions answered. We do a lot of fun charity events. We're always looking for volunteers or folks who want to sponsor or partner. Actually, if I may.
Sure.
I forgot I had this in my pocket.
Well,
a big charity that we support and advocate for all the time is the Red Nose Project. Yes, this is a goofy red nose.
Yes.
So if I can interject, I'm sorry.
The Clown Project. There you go.
Almost. Yes.
Yeah.
I know I'm a bit of a goofy clown myself, but the red nose is a beacon, a representation to support children and family in needs. A lot of us have worn the pink ribbon for breast cancer awareness, right?
Yes.
That's a symbol, a beacon with regard to breast cancer education and care. Well, in much the same way, this is a beacon. Yes, it's a red nose, a clown that you wear, and you're basically announcing to the world through laughter and jokes, we support the children and family who are in need. But this cracks a smile on people. This kind of breaks the conversation into something beautiful. And I'll tell you, our organization.
You missed your calling.
I know. I'm going to go back to clown school. Yeah. You can be my classmate, Mark.
Yeah, there you go. I'll come with you. I'll come with you all day long.
But what's nice is we've given out 15,000 noses to date. We've helped children and families with medical supplies, school gear, backpacks, time with children, employment for families, blanket, food, all kinds of sources through this fun-filled adventure, the Red Nose Project. So it is a symbol. We've had great photos and videos behind this. A lot of celebrities have pushed out this initiative, as well as some companies. So this is one of our big charities. And again, coming to transparency, first is good works to support your communities. But this also creates a very loving environment. Imagine walking around and you have a governor who's wearing a nose and a 10-year-old kid. You have a bus driver, you have a teacher, you have a doctor. Everybody's the same. We are now at a round table like the days of old. Everyone is equal in their rights, equal in their citizenship, equal in their DNA.
Yeah.
By doing these charitable events, and that has helped us get closer to people and make them feel comfortable. Like, well, if my doctor and my congressman are hanging out with me or doing these charity events, then they understand my problems too, because they too have the same issues and problems.
That sounds
so
like
this has helped us really
project.
build a lot of fellowship amongst other things. Yeah. So I keep this
phenomenal.
in my pocket sometimes.
That's great.
I'll give you one.
You're doing great work, and we want you to continue to do that for sure.
Thank you, my friend.
So having said that, really appreciate you all talking with us. Appreciate you coming in, Raj, today, and I hope everybody got some great information. We're looking forward to the next time we can talk to Dr. Raj. That brings us to the end of today's episode of Hilton True Wealth. If you want to learn more about topics relating to building your wealth, tax planning, cutting-edge tech, and family office services, we're here to help. Be sure to follow us wherever you get your podcasts so you'll never miss an episode, and give us a like or a review. And if you're curious to learn more about your wealth, tune in every Tuesday for new insights and special guests. If you found value in what you heard today, share it with someone who might benefit too. For more insights, resources, and to get a free copy of our book, Hilton Wealth, How to Invest Like an American Dynasty, visit us at hiltonwealth.com. Thanks for joining us. Until next time, keep learning, keep growing, and keep
building your true wealth.